COVID-19, also known as coronavirus. We have had a confirmed case of COVID-19 here in Norman, and as we've seen from the rest of the world, we will likely see more. But as I have said earlier, this is not a time to panic, it's a time to get prepared. And so I really appreciate the time that we have with our professionals here today. And joining me to discuss this topic is Dr. Stephanie Barnhart, a board-certified emergency room physician with Norman Regional. Dr. Barnhart, thank you so much for taking the time to speak with us today.
Thank you for having me.
So there's a lot going on right now, lots in the media, lots on social media. What do you think is the most important thing people need to know right now?
Right now, the important thing is to not go to the emergency room unless essential. And the people have to remember that we're still dealing with day-to-day emergencies, the heart attacks, the strokes, different trauma, so that's what we're dealing with. And then if people are having symptoms related to the virus, such as fever, cough, or shortness of breath, those would be symptoms you could come to the emergency department. You can also call your primary care doctor. But those, if you're not that ill, if it can wait, then please wait and don't come to the ER to get us overwhelmed.
Okay, thank you. So we hear a lot about testing, lack thereof, when are we getting more, all of that fun stuff. Where should people who think they need testing for COVID-19 go or do?
Right. So not everyone will need to take the test. If you have developed any symptoms, as I mentioned before, of the fever, cough, shortness of breath, then call your primary care doctor. They've all been informed of what to do. They'll call the health department, and then they can let you know about an appointment time to go set up and get the test. If you do not have a primary care doctor, then we are directing everyone to call the hotline, and we can list that number on our page, but that number is 877-215-8336.
Okay. And the great news about testing is we can only get more at this point. There is no getting less. So we got that going for us. I try to see the bright side of things. So we hear that COVID-19 symptoms are like the flu, and that may confuse people on whether or not what it is they're dealing with. So what are some of the signs and symptoms of COVID-19, and how are they different from the flu?
Sure. So the COVID-19 or coronavirus is a virus, and so like other viral symptoms that we have seen previously are the cough, congestion, sore throat, runny nose, fever, shortness of breath. The difference is the fact that this is an order of magnitude much worse than the flu. It's the growth of it is exponential, and so it can overwhelm the system very quickly. We're seeing this in Italy right now, the severity of just how fast it's spreading, and this is what we've learned thus far is that it is a novel virus. So meaning that we have, as a population, has never seen this type of virus before. So we have not developed any antibodies to it before. So most of the people, a lot of the population that does get the virus will be okay, but there's about 20% that will need to be hospitalized. And that's what we're trying to avoid, is that everybody having to come to the hospital all at once. We'd like to spread this out over a longer period of time.
There's been a hashtag going around about flatten the curve.
Sure.
So it's shown that cities that have been proactive have, kind of one of these, and those that wait too long to implement policies to discourage that have one of these, and that's what crushes our healthcare system.
That's right. And so what we're trying to do is to, and again, meaning by flatten the curve, meaning to spread out the virus over a longer period of time versus seeing that high growth and overwhelming the healthcare system, such as that's done in Italy.
Okay. So speaking of flattening the curve, what should people do to stop the spread of COVID-19? Oh, we may be having some technical difficulties here there she is. Okay, I was going to fill people in on what we've done from non-pharmaceutical interventions on the city side, but they want to hear about from you right now. So how do we stop the spread of COVID-19?
Right. So all the things that we've talked about before, and just usual hand washing, wiping doorknobs. The biggest thing right now that we're seeing such extreme measures being taken is the social distancing. And that is something that everyone has to really, just do, not only for yourself, but for those people that you will never meet. And so people can have this virus and not even have any symptoms. And they won't show up until a few days later. And by then it's already too late if you come into contact with someone else. So that social distancing, which people say up to about 6 feet, is very crucial.
And so social distancing isn't just to protect yourself, I'm hearing, it's also to protect your neighbors.
That is correct.
And so I know that some retirement homes and facilities like that, given that this has a more deadly impact on our older residents, have limited visitors. Is Norman Regional doing anything to limit visitors to its facilities?
Yes, and we have a policy that gets updated every day. And right now our policy is to limit 1 visitor per patient. If you have if you're visiting someone in the ICU or the neonatal ICU, you'll get your temperature taken. And so right now, just 1 visitor per patient.
I'm back on here. I have a quick question for you. We're hearing people say it's not a big deal, and it is a big deal, and a lot of 180s are going on right now. Dr. Barnhart, as an emergency room physician, what is your level of concern regarding this outbreak?
It's very high, and I think that we are wanting to, just because of the overwhelmed healthcare system that could be possible. Right now, we're seeing the numbers just continue to grow exponentially, and so we want to we're still dealing with the day-to-day emergencies, and so we have to be able to have the ability and capacity to care for this pandemic that we're seeing. And so, it's, about 20% of those patients that do get this virus are going to need hospitalization. And so we want to spread that over a longer period of time versus this high peak in a short amount of time.
Now, you mentioned the resources in place to help manage what we know is coming. And one of those resources is the human resources, people. So the Norman Police Department just released earlier today new procedures they have in place about managing COVID-19 and things that they're changing. What measures are in place to protect our healthcare workers?
Right now, we as healthcare workers are all wearing masks and gloves with any patient. So regardless of what symptoms, it's being recommended to us that we just protect ourselves. We wash in, wash out every time we come into the patients and leave. And then when we have someone with respiratory complaints, we have special PPE or personal protective equipment that includes a gown, mask, and gloves.
Okay. And have we had any issues with getting that kind of equipment? I mean, do we feel prepared?
Well, it is definitely limited, and we are using it conservatively, but we will use it as needed, and I believe it will be available to any patient that we need it on.
Excellent. So for those of you that are watching, if you have questions that I didn't ask, please put them in the comments. Even after I share this video later, Norman Regional will be monitoring this and will answer your questions, because we know that more information is better. But as I've said earlier, don't be scared, be prepared. There is no reason to panic. We have our Emergency Operations Center in place. Norman Regional is clearly ready. We just need our residents to do their part as well. So Dr. Barnhart, thank you so much for your time today. I really appreciate it.
Thanks for having me.
All right, for all of our watchers, thank you so much for joining us today. We will keep you updated. Please like and share this video so that more of the community can hear the information that we talked about today. Thank you so much, everyone. Have a great day.